Nobody really knows how doctors think. What are the processes by which we solve problems or solve diagnostic mysteries? A big chunk of what we do is dealing with patients who have a constellation of symptoms that currently defy explanation. And when those patients come in, we have to become detectives. The solving of diagnostic mysteries and the treating of complex patients for which a diagnosis has not yet been arrived at is part of the role of an internal medicine specialist. Medical problems are often complex, they're often multiple, they're sometimes hard to diagnose. Internal medicine is really about managing patients holistically, about prioritising, problem solving and fixing. When we train rural generalists in internal medicine, they have a significantly improved ability to manage their complex patients, and they make much better use of the available specialist services, whether that's a telemedicine service or a fly-in specialist service.
I first got into internal medicine because it's a way I find to do more in medicine. You can look a lot further on your own. You can go hunting for things that you'd otherwise find it difficult to find. I see internal medicine more as an approach to dealing with a problem rather than a specific ability. You have to be thorough, you have to be driven to keep looking, you've got to keep looking at everything, you can't leave something uninvestigated.
People who choose internal medicine have to have a heap of intellectual horsepower. They need to be able to learn and retain a large amount of factual information, but then they need to be able to apply that information when they're communicating with patients who have never read the textbook and who will present in unusual and exotic ways. They really cherish and enjoy problem solving, and they're not satisfied with just fixing the problem that's right in front of their face. They want to see the big picture and the little picture, and they want to solve all of those problems at once.
Being able to do as much as you can for your patients has to always be the driving force behind it. And internal medicine, I think, really allows me to do as much as I can for my patients at the highest level that I can to manage them myself. I think internal medicine makes me feel a lot more comfortable in what I do as a rural generalist. I have been given a lot more skills and a lot more ability to deal with a number of complex patients, and I feel much more comfortable in working rurally, having those skills behind me.